Hello everyone, I am Ramasamy from the Department of Oral Medicine and Radiology. I'm going to discuss about the tobacco and ill effects of the same and the ways of treating the tobacco disorders. Tobacco is a common name for several plants in the genus Nicotiana of the family Solanaceae. More than 70 species of tobacco are known and they are used for recreational purposes. The word tobacco is said to be originate from the Spanish word tobacco, T-A-B-A-C-O, but there are several controversies remains unresolved till date for the origin of the word. The earliest description of tobacco was thought to be from the year 1595 and its usage exists till date. The tobacco is available in two forms, smoking form and smokeless forms. The smoking forms of tobaccos are cigarette, bidi, cigar, pipes, hookah and doka. And smokeless forms of tobacco are areca nut, in which it is either used along with the betel leaf. The other smokeless forms of tobacco are snuff, gutka, snus and many more. According to a survey conducted in the year 2020 regarding the top tobacco producers, India stands second of about 7,61,335 tons per year. Mostly the youth ages 13 to 15 and adults above 18 are affected in this. And men are more commonly affected than the women because of the peer pressure from the friends and imitating the family members that are using tobacco. Tobacco products are addictive in nature mainly because of the nicotine, a powerful neurotoxin and in which it poses various health hazards to people who consumes it. They are mostly seen in the tropical areas and are also available in Andhra, West Bengal and Kerala and many more. Even the information about tobacco, the reason of knowing knowledge about the tobacco because they are highly addictive. Now we will talk about the ill effects of using tobacco. Smoking leads to disease and disability and harms nearly every organ of the body. More than 1.2 million Indians are died because of active and passive smoking, and more than 230,000 Indians die each other because of smokeless tobacco. Smoking causes cancer, lung disease, heart disease, stroke, diabetes and much more. Smoking can also increase risk for tuberculosis and certain eye problems and problems for the immune system including rheumatoid arthritis. These are the effects that are attributed to the active smoking of an individual. And then there is the second-hand smoking or the passive smoking. Second-hand smoking is the non-smoker in which he is sitting next to the smoker and inhaling the smoke coming from the tobacco. Second-hand smoke exposure contributes to appear 41,000 deaths among non-smoking adults and 400 deaths in the infants each year. Second-hand smoking causes stroke, lung cancer and coronary heart disease in adults. In children, it also causes respiratory diseases. It also affects the pregnant woman and increases the complication to the unborn child during or post-partum. These are the systemic manifestations of using tobacco. There are also oral manifestations and are caused due to the intake of smoking and smokeless tobacco forms. Potentially malignant lesions such as leukoplegia, smokeless tobacco pouch keratosis, cancerous lesions like oral cancer due to squamous cells can occur in oral cavity. Cancerous lesions can be fatal if not diagnosed and treated early. Hence, awareness, knowledge about tobacco and frequent screening of oral cavity is required to avoid the mortality and morbidity which is caused by the tobacco.